The province announced new COVID-19 measures this week in an attempt to fend off the rising threat of the Omicron variant. For her thoughts on the latest, we're joined by Dr. Janet DeMille, the Medical Officer of Health for the Thunder Bay District. Dr. DeMille, good morning.
Good morning.
Thank you so much for taking some time. We do know how valuable and how precious your time is.
Yeah, these are certainly busy times.
I can only imagine. So we'll jump right into it. What was your reaction What was your reaction to the new measures brought in by the province this week?
So I wasn't surprised to hear some of the measures that the province is considering. I mean, we heard about measures in long-term care homes to protect them. We saw the capacity limits on those really large venues, typically sports venues. And some more information about the deployment of rapid testing. I think, though, that when I saw the modeling presentation yesterday put on by the Ontario Science Table, and when I had a chance to review it and looked at the numbers, I think, Ontario and of course us are in for a rough time in the coming months, and that the measures that the province currently has put in place won't be enough to really make a dent in the kind of spread that we could be seeing. So, waiting, for any additional information about what else the province might be doing, but, and then, of course, looking at what we need to do up here to protect the public. And the travel advisory that we issued yesterday was sort of one part of that.
Now, eligibility for booster shots has just been expanded. How quickly do you think you can get those boosters shots into arms in our district?
Well, you know what? That was one of the biggest things we've been working on this week. So I was in meetings with the province on Sunday and connected with a couple of healthcare partners, coming out of that and earlier this week, and really trying to ramp up the provision of really all vaccines, even for those who need a first and second dose, but booster doses as well. And we already had a fairly full schedule for our clinics, but really looking at increasing those. And I think we have been successful in terms of engaging other healthcare staff to come and join us, at our clinics here in Thunder Bay to get those booster doses and open up more appointments. And that is, by the way, an ongoing process. We're still very actively engaging. This is not something that it's just the staff of the health unit that can do, but so we have healthcare partners joining, and I can tell we have been able to ramp up even this week and anticipate more in the coming weeks. And we also see partners, including here in Thunder Bay in the district, kind of preparing for some of their clinics. So, and of course, pharmacies remain a vital partner in this, and I can see that their numbers are going up as well. So I know that people may be struggling to get an appointment because everything's booking up so quickly, and there's a big demand. But we will be, more appointments will be available, fairly shortly to help accommodate that demand.
I mean, that's the next segue into the next question, because coming this Monday, people aged 18 or older can now book their booster shot with the prerequisite that there has been at least 3 months that has passed since their second shot. That wasn't the case for people aged 50 and over. There was a 6-month time period that was required. Are you confident that those people who are in the 50-plus age group that are still needing their third shot will be a priority and they won't get pushed aside?
That's an excellent question, John, and that's sort of thinking like a public health person. We do want, and it is the government's goal to get those people that may be more vulnerable or more likely to have serious illness where they might require hospitalization, and age is one of the big risk factors. So the older somebody is, the more likely they could have that. So the opening up to the 18 plus could mean that some of those folks that are older may not be. I mean, it's sort of maybe challenged to get an appointment. So I mean, right now we are doing a lot, and currently it is still the 50 plus that are able to book appointments. So we're trying to open up a lot, including getting into January. So they will be able to maybe have priority until Monday morning when the broader group will be able to access. So if somebody is, for example, over the age of 70 or over the age of 50, paying attention to our social media as we add more appointments, they could potentially be able to book in or through pharmacies and through other channels.
Now, this week, the province also announced plans to give away free rapid antigen tests at pop-up sites over the holidays. What do you know about access to those tests in Northern Ontario?
So I think there were sort of discussions about where that might happen in our area, and I think it was primarily Thunder Bay where that could happen. And I haven't had any updates myself, and I noted that we weren't on the list. So it was a list originally put up, I think, was it yesterday or a couple of days ago? So I don't have a lot of the details on that, and I know there's supposedly going to be available at some LCBO locations, and I think there is one that may perhaps have that that's on the list. So I do expect to hear a lot more about this. However, and we know that school children came home with rapid antigen testings or will be taking them home this week for the holidays, so that was already put in place. I think what we're going to see, though, is a fairly high demand for these rapid antigen tests, and the supply the full supply not necessarily being there at the provincial level at this time. So I'm not totally sure how these will be deployed so that everybody will have access to them.
Now, speaking of children, you're still the public health unit is still attempting to get children aged 5 to 11 their first doses. How satisfied are you with the numbers of children who've been immunized at this point?
So I'm really pleased to see that this group is still coming forward to the Immunize, and that's sort of every day, and that's through a number of channels, including our clinics, pharmacies, primary care, and other clinics. We're close to about 41% of children 5 to 11 having had one dose, and that went up about 1.5% since yesterday morning. So that shows you what we were able to do yesterday across the Thunder Bay District Health Unit. So we do know that, and through some of our clinics, we do know that we do have people have those appointments for that age group. But we have seen overall a petering off of the numbers, and that's a provincial thing. In fact, we're doing overall better than the provincial average at the present time. So I think we're on track. But certainly, we'll be continuing to encourage that particular age group, their parents, to really consider getting their children immunized as we face the Omicron variant, as we really want to keep schools open and functioning for in-person learning for that younger age group. That is really vitally important, and the vaccine is a key, one of the a key measure to achieve that.
Now, one of the biggest issues that I think I've experienced, and I want to say it's fair that most people have experienced, is just the information that is available. Not that there's not enough information available, but that there is a lot of information available. So can you help us navigate which numbers that we should be watching closely to determine what situation we're in? So should we be looking at overall case counts, hospitalizations, or is there any other figure that you think would be appropriate?
Yeah, you know what? I think that's an excellent question, and when we start navigating the issues of Omicron, which might be fairly broad spread in terms of the numbers, and it'll be, we might not be able to actually count everybody who actually has Omicron. I mean, that's one of the issues. Certainly right now, we don't have a lot of Omicron here, and we're still Delta. We will be continuing to report our case numbers, and we also have on our website, which we update once a week, is the 7-day case numbers, which actually has been dropping recently. We're one of the few health units that's dropping, but sometimes on any given day, the case numbers may go up and down. But if you look at the last 7 days, that's often a bit more of a stable measure. I think, though, one of the big indicators that we watch and monitor very carefully is hospitalizations, because, Omicron is believed to be less severe overall than Delta, but given the number of people that are expected to get Omicron, including those that are fully immunized or have 2 doses, there might be enough people that require, hospitalization because of severe illness that the hospital sector and the acute care sector will be significantly impacted. So that will be a big number to follow, both what's happening here and provincially.
Now, the Northwestern Health Unit is asking people to avoid travel outside of the region over the holidays. If people already have travel plans in place, would you recommend that they rethink those plans?
So we did issue our advisory last night. That's very similar to what Northwestern did. In fact, we were in touch with them earlier this week about that. The reality is, I think we're going to see very substantial increases of COVID-19 due to Omicron in other parts of the province and other parts of the country, and this is going to manifest even over the next few days in the next couple of weeks, and it will be quite significant. And so people need to realize when they travel that they can be exposed to Omicron. Where it's safer to stay here. And if they travel, and especially if they do those activities one often does at the holidays and gather together with others, that there's a good chance that they could get exposed to that. And it will spread among their family, their household, and when they come back here, it can spread to, workplaces or family here, and it will spread quickly. So we are asking people to really look at their plans over the holidays and consider, not traveling or doing something different than what they had planned. If somebody, really deems it essential that they go down to visit family, then okay, they can go, but they should limit their interactions with other people, avoid any larger gatherings, and sort of stick with a certain bubble of their family when they're down wherever they are. And then when they return to our area, we're asking people to essentially stay at home for 10 days after their return. And only leave the house for sort of essential reasons, to not gather together with others, their friends or their family when they return here, or not, to follow whatever workplace policies their workplace has. We have already seen people coming from other areas, and that includes Minnesota and Wisconsin and Manitoba and other parts of Ontario, where they have brought COVID back here, and it has spread back here. And right now, I'd like to hold off Omicron arriving to our area for as long as possible, so that we can, do all those immunizations that we want to do, that we're ramping up to do, and we can understand this variant a little bit more as well, and make evidence-based decisions on that. So. And very much encouraging people to read what we put out yesterday around travel, consider, what they might do, how they might change their current plans, including perhaps deferring any travel to a better time.
Dr. DeMille, thank you so much for joining us.
Thank you very much, Sean. Appreciate it.
You have a good day. It is currently 7:53. And that was Dr. Janet DeMille, who is the Medical Officer of Health for the Thunder Bay District.